You know that feeling when you get a hospital bill that costs more than your car? When you can't get an appointment for weeks? When the doctor seems rushed and stressed? Well, there's a reason for all this, and it's not what you might think. For the past decade, healthcare has gotten more expensive, harder to access, and frankly, worse. While politicians debate, families go bankrupt from medical bills. And doctors, the people who actually know how to heal, are frustrated and leaving medicine in record numbers. But here's what nobody's talking about. Buried in the Affordable Care Act is Section 6001, a provision that kicked doctors out of hospital ownership. That's right, the people who actually treat patients can't own the hospitals where they work. But private equity firms, insurance companies, hospital corporations run by MBAs who've never touched a patient, they can own as many hospitals as they want. And this wasn't an accident, it was lobbying. Big hospital networks and insurance companies were terrified of competition from physician-owned hospitals because study after study shows doctor-owned hospitals deliver better care at lower cost. Think about it. Who do you trust more with your family's health? A doctor who's dedicated their life to healing, or a corporate executive worried about quarterly profits? When doctors owned hospitals, they made decisions based on what was best for patients, not shareholders. They knew every nurse's name, understood the community's needs, and yes, they kept costs down because they actually cared about the people they served. And now? Well, now we have private equity stripping hospitals for parts, laying off nurses, and closing emergency rooms in rural communities. But there's still hope. We can actually fix this, and it's quite simple. Repeal Section 6001. Give healthcare back to the people who understand it, doctors and patients. When physicians can own hospitals again, they'll compete on quality and cost, not marketing budgets. They'll hire more nurses, not more administrators, and they'll focus on healing, not billing. Your congressman needs to hear this. Share this video. Tell your story. Demand that they repeal Section 6001. Healthcare should be about patients and doctors, not corporate profits and insurance companies' spreadsheets. It's time to give medicine back to the people who actually practice it.